Okay. So this is the first lecture of topic 8.1. This is video 1 for this first lecture. So topic 8 is the respiratory system, and in this lecture we're going to go through basically the anatomy of the respiratory system. But first I want to do kind of a overview just of the general function, or functions I should say, of the respiratory system. So there are basically 4 functions of the respiratory system. Okay, so the first function is what's called ventilation. So ventilation means basically the moving of air in and out of the system, and particularly moving air in and out of the lungs. And why do we do that? So, just you can think about what happens if you hold your breath. What happens to the air in your lungs. That air, basically, so your body sucks up the oxygen, sucks oxygen out of the air, puts carbon dioxide into the air, and after a little while, the air in your lungs would basically have the same gases as the air as your blood. You wouldn't be able to do any more gas exchange, and so the whole point of the respiratory system is to get oxygen to go into the blood and take CO2 out of the blood. In order to do that, you have to kind of constantly wash in air in and out of your lungs to keep the air in here nice and fresh. Because if you don't, that air will become what we call stale, meaning it will have low oxygen, high CO2, and it won't be really any good for exchange. Okay, so ventilation, moving the air in and out. And then sort of the next thing that happens in the respiratory system is what's called external respiration. So external respiration refers to the actual movement of gases so you can basically see it up here, the movement of gases between air in the lungs and the blood. So, and of course, what gases flow where? So as you probably know, oxygen you breathe it in, and then it goes into the blood. So you take oxygen in, and then CO2 goes from the blood into the lungs, then get breathed out. So oxygen from lungs to blood, CO2 from blood to lungs. That's external respiration. Okay. The third part of the respiratory system, and it's sort of not often thought of. So so parts 1 and 2 are what we sort of traditionally think of as respiratory functions, but there are 2 other things that have to happen in order for respiration to be successful. So, you can breathe the air in and out, you can move the air back and forth, get oxygen into the blood, CO2 out. But ultimately, the whole point of doing this is then to provide the tissues with what they need. So you're going to have to get that oxygen to the tissues and absorb CO2 and take it away. And these are really just as much part of respiratory function as this stuff up here. So the first thing you have to do, after you do this exchange of the blood here up in the lungs, is you have to move that blood around the body to the tissues. So transport of O2 and CO2. Okay, so once you get oxygen to go in, you have to bring it to the tissues, and once you absorb CO2 from the tissues, you have to bring it to the lungs. So transport is critical for respiratory function. Of course, it's not, what makes it happen is are structures that we don't usually think of as part of the respiratory system, right? So obviously, the circulatory system is responsible for transport, but you can't have respiratory function unless you have the circulation. And then finally, so we've done the gas exchange. So we've brought air in through ventilation. We've done the gas exchange, external respiration. We've transported the blood around to the cells. And then the last step is called internal respiration. Okay, so it's basically this process down here. So, and that's basically the process of then exchanging gases between blood and tissue. So where do the gases go? So oxygen goes from blood to tissue. CO2 goes from tissue to blood. Okay, so those are basically the four functions that are necessary for the respiratory system to be doing its work. And so these are all basically part of the overall major function of the respiratory system, which we call gas exchange. Basically bringing O2 from air to tissues, and then taking CO2 from tissues and expelling them into the air. So gas exchange is the general sort of major job of the respiratory system. But there are basically two other things that the respiratory system does for our bodies. So one is that it helps regulate pH. So, thinking about what we talked about up here, one of the substances that we named in the gas exchange, the part of the job of the respiratory system, is also involved in pH for the body, and hopefully you guys immediately gonna yell out the answer. That substance is CO2, right? So, as you hopefully remember, as CO2 levels in our body go up, we get that old equation where CO2 combines with water to make H2CO3, which then goes to make H plus and HCO3 minus. So as CO2, concentration of CO2 goes up, leads to increase in the concentration of H plus, which is decrease in pH, and vice versa. CO2 goes down, pH goes up. So the respiratory system can basically get rid of CO2. We blow off CO2 out of our lungs. So increasing respiration, increasing respiratory function, increasing elimination of CO2, which causes pH to go up. So it turns out that respiratory function is actually pretty important for regulation of pH. And in fact, pH is the main variable that regulates respiratory function. So we'll talk about this at the end of this topic, but the thing that our respiratory system is actually most sensitive to is changes in pH, and changes in pH are the biggest driver to how fast or how slow we breathe, basically. Okay, so that's one of the other jobs of the respiratory system. The other one is something that's particularly important in humans, and that's the production of voice. So humans are very vocal animals. We use our voice for a large portion of our communication, and so we have this structure, the larynx, that is used to create the sounds of our voice, and then our whole respiratory system is involved, basically, in our whole respiratory tract. All these structures here are involved in pushing the air through our larynx to create the sounds for our voice. And then let's kind of make a list. So sort of anatomical parts of the respiratory system. So the first one, and this might seem sort of surprising that we're just going to call it all one thing, is what we're going to call the respiratory tract. So the respiratory tract refers to all this stuff here, nose on down through the lungs. These are the parts that actually pass air. And so you might be thinking, okay, so that seems like that pretty much gets us to the parts of the respiratory system, but not quite true, right? So first of all, going back to our list of functions, think about how we said transport of O2 and CO2 is an important, key part of respiration, right? So there's another system that we have to include as part of the respiratory system, which is the cardiovascular system. That's what accomplishes the gas transport around the body. And then there's actually one other part of the system that's necessary for function. Oh dear. I think I may be going off the screen a little bit on the right side over here. Sorry, I'm noticing that. Let me fix that. So there's that part, and then here's the CO2 equation, which hopefully you all know anyway, but okay. Yeah, so parts of the respiratory system, respiratory tract, cardiovascular system. There's one other actual set of structures that's important, that's necessary for respiratory function. So let's think about ventilation a little bit. Oops. There we go. Let's think about ventilation. So how do you ventilate? How do you bring air in and out? Looking at the respiratory tract, which one of these parts is basically responsible for actually doing the movement of air? And it's kind of a trick question because the answer is none. None of these systems, none of these parts can move really, or at least can't move in a way that can cause air to blow in and out. So to get the air to move, you need yet another system, which is the musculoskeletal system. So basically the rib cage and the muscles of the rib cage, particularly the diaphragm and then the intercostal muscles between the ribs. These are all necessary to move air. So, musculoskeletal system, the rib cage, which is the skeletal part, and then the diaphragm and intercostals, intercostal muscles. Okay. These are the main muscles. Diaphragm and intercostals are the main muscles that we use for ventilation. There are actually some other muscles we can use, which I'll talk about in another lecture. Okay, so those are all the parts and their basic function. Let's look more closely at we're going to look more closely at basically the parts of the respiratory system today. Or particularly the respiratory tract. So, for the rest of this lecture, we're going to basically look at the anatomy and histology of all the parts of this respiratory tract, from the nose on down to the lungs, and specifically the alveoli in the lungs. Okay. Traditionally, by the way, and you'll hear this often, especially clinically, respiratory tract is divided into upper, which is basically nasal cavity and pharynx, and then lower, which is larynx on down. It's a pretty informal distinction, so people might quibble about what where upper and lower end. But you hear people talk about like an upper respiratory infection, basically sinus infection, or basically cold kind of thing, versus a lower respiratory infection, which is an infection that actually affects basically the lungs. Okay, so pneumonia. Starting with the nose. So the nose is generally the main way that most of our air gets in to our respiratory tract. So air comes in through the external holes called external nares. So these holes here, external nares. Nares, as you may have noticed, are lined by hairs, and you can probably guess what the function of those hairs is. It's essentially a filter, helps prevent particles from getting into the respiratory tract. From there, the air enters into what we call the nasal cavity. That cavity is lined by a mucous membrane that generates a sticky fluid called mucus. That fluid kind of has two main functions. So first of all, it's another way that particles can get trapped. So as you breathe in, if something makes it past the hairs, then those most of the particles that make it in get trapped here in that mucus. So it helps basically serve as another filter. The other function of the mucous membrane is that it warms and moistens air, so that the air, as it travels down and gets into the lungs, is basically already more or less in the same state that it'll be once it's all the way in the lungs. So the air in the lungs is going to be warm and moist. We want to get that air as warm and moist as possible before it gets down there, just because the lungs aren't very well equipped to deal with big temperature differences or moisture differences. So your nose does most of that moistening and warming. Sort of a key feature of the nasal cavity that you may remember studying in MP1 are ridges. So these are actually ridges of bone that are covered with mucous membrane. These are called the conchae. So there's three of them. Here's the superior, here's the middle, and the inferior concha. So conchi is plural, singular is concha. So what do the conchi do? They basically maximize the ability of the nasal cavity to do what it needs to do. So right, we said that basically has two functions: helps trap particles, helps warm and moisten the air. So that what the way the conchi basically contribute to that is, so first of all, they just increase the total surface area of mucous membrane in the nasal cavity, right? So more surface area, more opportunity for particles to get trapped. Also more, so contact with the air to warm it and moisten it. Other thing that the conchi do is that they create turbulence in the air as it comes in, which is good for these functions. So you can imagine if you were breathing in, that if the air flowed very smoothly, you could get some air to come in, and it's kind of like, remember in the vessels we said that the blood in the center of a vessel flows very quickly and sort of efficiently in that laminar flow pattern. Well, air can do the same thing. Air could flow in and flow very quickly past the nasal cavity down into the rest of the respiratory tract. If air were flowing really smoothly, what the conchi do is they make that air get all mixed up, create a lot of turbulence in that flow of air, so that all the air ends up basically getting mixed around in here before it then continues down the respiratory tract. Okay. Okay. So next we come to the next region of the respiratory tract, basically from here down to about here. So that region is called the pharynx. It's the name of just sort of the tube that lies posterior to the nose and mouth. So, and it's got three components. So there's this area up here that's a bit posterior to the nose, and it's called the nasopharynx. And then the next region down is the area that's basically posterior to the mouth, and that's called the oropharynx. So if you look in the mirror, open your mouth, you see that red wall at the back of your throat. That's the back wall of the oropharynx. And then the bottom region here is called the laryngopharynx. It's the most inferior part of the pharynx. It's called the laryngopharynx because it's where this structure called the larynx is found. And the larynx is the system. It's the structure that basically provides the pathway for air to flow in. So one of the things I kind of didn't mention about the pharynx. The pharynx is interesting because it's part of the respiratory tract, as we're saying, but so air flows through it, right? But what else can flow through the pharynx? So think about the oropharynx. It's in the back of the mouth, right? So obviously, ingested material flows in through the pharynx as well. So air and food and liquid can both pass through the pharynx. The pharynx is part of both the respiratory system and the digestive system. So the larynx then is the structure that basically is the entry point to the region that should be purely air. It's the entryway to the lower part of the respiratory tract. Normally, nothing but air should ever go through the larynx, and in fact, we'll see it's sort of designed to block the passage of ingested material into the respiratory tract. so, and then so, and you can see that like after the laryngopharynx, you get this parting of ways. The air goes anterior, whereas ingested material should stay posterior in the esophagus. Okay. So, there's a clinically important aspect of the pharynx, and it's this structure here. It's called the soft palate. So, if you put your finger in your mouth and touch the roof of your mouth, it's hard and bony. That's this stuff here. That's the bony palate. But if you keep moving your finger back, and hopefully you can not gag yourself, eventually you'll find that the bone ends and you get to soft tissue. That's the beginning of this structure here, the soft palate. So generally the palate is responsible for separating the oral cavity from the nasal cavity. The soft palate is a soft structure with muscle but no bone that separates the back part of the oral and nasal cavities. The sort of the clinical issue with it is that it commonly becomes, so normally it's got muscle in it. It's got muscle in it, and it's normally the muscle is sort of arranged to help basically keep the soft palate in a relatively elevated position, sort of right in the middle, so it doesn't block passage of ingested material or air. But there are people who, for whom this soft palate seems to get kind of floppy, and what can happen is a soft palate, especially when people like lie down and lie on their backs, is when it most happens. That soft palate can kind of flop into the pharynx and really block it off. In fact, it can get pretty big and even come pretty far down. So it partly blocks the oral passage of air, so air can't get in really even through the mouth as well as it normally does, and can completely block off flow through the nose. And again, this when people mainly have this problem is when they're lying down, and particularly during sleep. So during sleep, the soft palate relaxes, and it can really come and obstruct the airflow, and that condition is something you've probably heard of. It's called sleep apnea. Apnea means just no breathing, so it means people who really stop breathing, sometimes for up to a minute or more during sleep. So sleep apnea, we think of it as probably being, it's a pretty common thing. We may think of it as being more of an irritation than a serious clinical condition, but it can be very dangerous. So first of all, it's been shown that when people get sleep studies, if they think they might have apnea, one of the things they do is they put a monitor on their finger for levels of oxygen, and then they can also do tests in the lab to look at O2 and CO2 levels in general, and they find that people with major sleep apnea can get really sort of dangerously low dips in their O2 and high levels of CO2 during sleep. O2 gets really low, CO2 gets really high. That in itself can be pretty dangerous, even in the short term. If it happens for a long time, so kind of skipping to number 3 on my list. So people who have prolonged sleep apnea. So people get often pretty bad cardiovascular, like heart disease and hypertension, and it's thought that it's basically because they spend so much of their life with low blood O2, high blood CO2, and that seems to somehow just kind of screw up their heart and their cardiovascular system and cause some pretty serious problems. Can even be fatal. And then another big problem with sleep apnea is that, and anyone who's sort of slept with a snorer or someone with sleep apnea could probably attest to this. So what happens is people with sleep apnea, they often, they'll They'll be sleeping. They'll begin one of these apnea periods where they're not breathing very well, or maybe not breathing at all, and then they'll suddenly like and kind of like arouse, partially. They'll basically partially wake up. They'll start sleeping. They're breathing better. Then they'll fall asleep. They'll start sleeping for a few minutes. Then the apnea hits again, and they'll wake up again partially. Usually they don't remember waking up at all, but they wake up enough that they're not really sleeping adequately. They're not getting, the REM sleep, the sort of restorative sleep that our bodies need. And what happens, and people, in fact, one of the things that often allows us to first discover sleep apnea is that people come in, they're like, I sleep 8 hours, but I'm completely exhausted all the time. I'm falling asleep, even falling asleep, behind the wheel. So it's actually a substantial cause of car accidents is, sleep apnea, leading to sleep deprivation, leading to falling asleep while driving. So that right there is a high, health risk, both to the person and to other drivers. So who gets sleep apnea? So, again, you probably know that it's strongly associated with snoring. Basically, the more you snore, the higher risk you're going to be for sleep apnea. Genetics is certainly a factor. People seem to have just sort of different inherent structures of their soft palate, and that can put you at risk. And then obesity is a pretty major factor. I'm not really sure why. It alters the structure of the soft palate, but we don't really fully understand the association. But it definitely increases your risk of sleep apnea. And then probably many of you have heard of the treatment for sleep apnea. So it's called CPAP, which stands for continuous positive air pressure. Basically, you put this tube in your nose. Some people, I think, have to use a mask for their nose and mouth, but these days I think most people just get a nose plug like that. And it literally just pumps positive pressure air into your nose all night to keep that airway open. And obviously it doesn't seem like it really would be that conducive to a good night's sleep, but I think for people who have bad sleep apnea, their sleep is so disrupted that they'll get their CPAP machine and they'll say, "Oh my God, finally I got a good night's sleep," for the first time in years. But in my opinion, just looking at that picture is a good motivator to try not to gain too much weight, because gaining weight definitely puts you at a higher risk. So, and that does not look like fun. Okay. Let's talk about the larynx. So the larynx, as we said, is this structure here basically the first part of the purely airway passages. So, and there are basically two functions of the larynx. So the first one we said was it helps basically prevent ingested material from getting into the airways. And then the other one is that it's actually the structure that's most important in our production of vocal sounds. So components of the larynx, starting from top to bottom. So the topmost part is this bone that you guys may have learned, hopefully, in A&P1. It's called the hyoid bone. And it's kind of this, so it's the only bone that doesn't actually articulate with other bones in the body. It's not directly connected to the rest of the skeleton, but it's highly interconnected to the rest of the larynx by basically ligaments and tendons. And it just sort of serves in a stable attachment for the rest of the larynx, and it then connects the larynx to the structures of the neck. The largest part of the larynx is this big plate of cartilage. So it's called the thyroid cartilage. So it's at the front. If you feel your neck, feel the front of your neck, men particularly can feel this a pointy part it's called the superior thyroid notch. It's sort of this it comes up to a point, so women should be able to palpate it too, but it's more prominent in men. This is what we colloquially call the Adam's apple, is this pointy part of the thyroid cartilage. And it's basically just a big protective cartilage plate. It's strong and thick and protects all the delicate stuff inside. So this is a sort of anterior view looking from the front. If you flip the larynx around, you can see there's lots of delicate stuff inside here, and the thyroid cartilage is essentially protecting it. Looking inside at some of these inner structures, so you get little folds inside, a couple of pairs of folds. The most important ones are called the vocal folds. So if we look in this picture here, this is this right here is a coronal section through the larynx, kind of a cool picture. You can see there's these what are called false vocal folds up here, but then the lower ones are the true vocal folds, or just some usually just called vocal folds. So this is some folds of tissue. So here's an image where we're looking down. Like if you put a scope through the mouth and looked down at the larynx, it would look like this. Okay, so this is obviously a diagram, and this is actually the photograph of what it looks like. And so these guys here, these are the vocal folds. They're the true vocal folds. They're basically folds of tissue that are inside. They have these real thick ligaments. And what they are, basically they can they during breathing are wide open, like you see them here. But then this diagram here sort of shows how the vocal folds can change position. So here is just sort of the front edge of the vocal fold, just the edge of the vocal folds being drawn in here. So they're attached and they come together at the front at the thyroid cartilage. But then at the back, each one of them is attached to this little guy. There's these two little cartilages here. Here's one, here's two. These are the arytenoid cartilages. So the back part of each vocal fold connects to an arytenoid cartilage. So here's one, here's the other. So during free breathing, the arytenoid cartilages are are basically separated out from one another. The vocal folds are separated from one another, and you get a nice wide open passageway for air. When you want to speak, what happens is these arytenoid cartilages rotate in like that. So you can see now they've rotated in. That brings the edges of the vocal folds together, and it becomes, basically then when air passes, it creates a pretty narrow space with these folds touching each other. When you pass air through that, it makes sound, and that's where the sound of our voice comes from. And then you can change the pitch of that sound by basically changing how much tension you put on your arytenoid cartilages. So if the arytenoid cartilages, pull down this way, they tighten the tension on the vocal folds, and it becomes kind of like a rubber band. If you sort of plucking a rubber band and then you pull it tighter and pluck it some more, you notice that the pitch of the sound from the rubber band goes up, right? The tighter the rubber band, the higher the pitch. Same thing here. The tighter the tension on the vocal folds, the higher the pitch of the sound. So let's think for a moment. So obviously these arytenoid cartilages can move. So here's their open position during free breathing. And then, what I'm doing a lot right now, bringing them together so I can make vocal sounds and moving them so I can change the pitch. Let's think about the muscle that's attached to these arytenoid cartilages to make them move, and ask yourself whether you think it's skeletal muscle or smooth muscle. So most of the muscles that's like inside of our bodies is smooth muscle, but smooth muscle is generally not we're not able to control it voluntarily. are you able to control your retinoid, the position of your retinoid cartilages voluntarily? And of course, you actually have exquisite voluntary control over that. It's one of the things that humans are particularly good at, is making very subtle changes to the position and tension of the vocal folds. So the muscle that attaches to the retinoid cartilage is skeletal muscle, voluntary muscle. Okay, let's see. Just basically finishing up the structure of the larynx. So there's a cartilage plate underneath here. So here's the thyroid cartilage, and you can actually feel it in yourself. You go to the thyroid cartilage, you go down, the first thing you'll feel is hopefully a little notch, a little indentation. That's this space. And then there's this cartilage plate right beneath it. That cartilage plate is called the cricoid cartilage. And something that, all right, one of the things probably the few things that I really still carry with me from med school, as I remember, is that this notch between the thyroid and the cricoid cartilage is actually a useful place to know about, because if you need to create an artificial airway in somebody's throat, this is the place to do it. So like if someone gets, like starts choking and they get food caught here and they can't get it out, you need to create an artificial way for air to get in. Grab yourself the nearest big pen, put the tip, feel for this little notch, put the tip on it and pop and create a hole. And this is the safest place to do it because has the lowest risk of injuring any of the nerves or major blood vessels that pass through here. So let's hope that never becomes handy, becomes useful knowledge for you, but in case it ever does, there you go. May have just saved a life, right? And then finally, just the last structure that we actually already talked about. So it's these little guys here, the retinoid cartilages, and as we said, they're the ones that attach to the vocal folds and control their position. And actually, no, sorry, I'm not done. There's actually one more part of the larynx that's actually very important. It's called the epiglottis. So it's this flap of cartilage up at the top. And what the epiglottis does, you can see it here. So here's a diagram, basically kind of a time-lapse diagram of someone during swallowing, right? So they've got some liquid they're swallowing. The liquid's going to pass down and then posteriorly into the esophagus. What I want to draw your attention to is this thing here. That is the epiglottis viewed from, viewed in this is a sagittal section. So, this is the epiglottis sticking up. It sticks sort of up and into basically the pharynx. So here's, a kind of a, maybe a slightly more, better, clearer picture of it. The epiglottis there, sticking up and sort of posteriorly into the pharynx. During swallowing, so do me a favor, and since you're in the privacy of your own viewing room, well, maybe not privacy, but wherever you're viewing it, put your fingers on your larynx and then swallow. If you need a cup of water to help you do that, feel free to pause and go do that. But what you'll notice is that the larynx during swallowing moves in a very regular fashion. So as you initiate swallowing, the larynx moves up, and then as you complete the swallowing, the larynx moves back down. The reason that happens is because during swallowing, so the larynx is moving up, and that causes this epiglottis to get bent down so that it basically functions as a lid that covers the opening to the larynx and the trachea. And this sort of downward flapping action of the epiglottis is really important to prevent material as you swallow from going into the larynx and into the trachea and ultimately into the lungs, which is dangerous because so whenever material does manage to get past there and make it down to the lungs. That's called aspiration. And sorry, some of that might have gotten cut off, but you get the idea. And aspiration is dangerous. Anytime you get food or liquid into the lungs, it creates a high risk for infection in the lungs called pneumonia. And so aspiration pneumonia is a very common problem. Especially, and it's, in fact, so people who have neurological diseases, things like Alzheimer's, sort of slowly degenerating diseases, the diseases don't tend to directly kill them, but what they usually die from is that their nervous systems stop being able to control this swallowing reflex adequately, and so people will get aspiration pneumonia. Then they'll get a bad pneumonia, and that'll kill them. In fact, and really anybody who's in anytime someone's sick, they're at a higher, their control of their swallowing isn't as good, and higher risk for aspiration pneumonia. It's a really big problem in the hospital. All right, I think I'll stop this one, and then I'll continue with part 2.